So let's see what are the contents. Kit 1, the grey in color. So grey here is there in old people. Usually old people, they complain of urinary incontinence. So they will have urethral discharge, cervical discharge and anorectal discharge. So the causes of urethral discharge we just discussed are gonococcal and chlamydia. Okay. So for gonococcal we are going to give cefixime to the patient, and for chlamydia we are going to give azithromycin to the patient. The dosage of cefixime is 400 mg stat and dosage of azithromycin is 1 gram stat. So remember, grey hair in old people they complain of urinary incontinence leading to urethral discharge, cervical discharge and anorectal discharge, and urethral discharge is caused by gonococcal and chlamydia, thereby we give cefixime and azithromycin. So now green color, things which are green in color, green fungus. Also we read about green discharge. So fungus means there is candidiasis. Green discharge is in trichomoniasis. So this is a kit for bacterial discharge. Trichomonas vaginalis include bacterial vaginosis also, since it's a kit of vaginal discharge. Kit for vaginal discharge. So the treatment involves giving 150 mg fluconazole stat and 2 gram of secnidazole stat. Then these three, white, blue, red, these are the kits for genital ulcer disease. Genital ulcer we include chancre, chancroid and herpes only. LGV doesn't have any ulcer or have a transient ulcer, and granuloma inguinal is very rare in India. So it is not included in the syndromic management. So 3 is for syphilis and chancroid, chancre and chancroid. So what we give over here is penicillin, benzathine penicillin, and for chancroid we give AZ 1 gram stat. Okay. So now the kit number 4, which is blue in color. Kit number 4, which is blue in color. So the patient getting kit number 4 is basically allergic to penicillin. Remember, blue pen, blue is pen. So patient is allergic to penicillin. So what we give instead of penicillin, we give doxycycline 100 mg BD for 15 days. Along with this, as we give 1 gram stat. So now kit number 5, which is red. What is red? Herpes. In herpes, the ulcer is having polycyclic margins and erythematous margins. So red, angry, herpes. In herpes, we give acyclovir 400 mg TDS for 7 days. Then 6, we have yellow. Yellow itself has lower abdominal pain. Happens in pelvic inflammatory disease caused by gonorrhea, caused by chlamydia and caused by Mycoplasma hominis. So what is the treatment of gonorrhea? Give cefixime to the patient, 400 milligram stat. Treatment of chlamydia, give doxy to the patient, 100 milligram BD for 14 days. Treatment of mycoplasma, give metronidazole, 400 milligram BD for 14 days. So black. So from B we have B, bubo. Bubo is caused by chancroid and by LGV. So for chancroid what we give is AZ 1 gram stat, and for LGV we give doxy 100 milligram BD for 3 weeks. So some points to remember is doxy we are giving in kit number 4, 6, 7. In 4 we are giving it 100 milligram BD for 15 days. Because the patient is allergic to penicillin, patient is having chancre. In kit number 6, for pelvic inflammatory disease, we are giving 100 milligram BD for 14 days for chlamydia. And in kit number 7, we are giving it for 21 days for lymphogranuloma venereum.